I've been thinking about artificial intelligence in healthcare for maybe a little over a decade, since about 2012 or 2013. And I'm excited about it as a chance to fix what I see as a system with a huge number of problems. And I think about it as a possibility to make things substantially better for a lot of folks. And so my questions are, how can law and policy ease that path, make it so we get the right tools developed that work for lots of people and get used widely? I think it's pretty easy to find lots of ways that AI can exacerbate bias and disparities in medicine. AI is trained on data, and the question is, where are those data collected? About whom are they collected? And how do they turn into systems that make predictions and recommendations? And if the answer is that those data are collected about only a certain set of people, we're going to have bad tools for everybody that's not in that set. And if the answer is that we collect data that are fully representative, but what those data are representative of is a healthcare system that is itself rife with deeply embedded biases, then the AI that results is going to reflect those biases as well. So unless we're careful, it's going to be very easy to reproduce or worsen biases in the healthcare system through the addition of AI. AI is developing really fast, and it's challenging to regulate, to figure out how it can work safely and effectively for lots of different people. Honestly, there's more regulation of AI in the healthcare space than in most other spaces. Lots of AI in healthcare falls under the definition of a medical device, even though it's strange to think of software as a medical device. The FDA certainly thinks that it is. And so hundreds of products have gone through FDA review to make sure that they are safe and effective. And that's simply not the case in lots of other industries. On the other hand, there are lots of things FDA doesn't see and lots of things it can't really do. It can say, does this system work in general? But it can't say things like, does it work at your hospital for your patients or for your patient, the one standing right in front of you? And so what might this look like in the future? I imagine a world of collaborative governance where we have some effort at the federal level to say, yes, this system works in general, but we also have more robust governance at the health system level where hospitals or health systems are saying, okay, here's the fact that this actually works for us, for our care patterns, for our patients. And that'll require some assistance because lots of places don't have the resources to do that so easily. But I think that's the real path forward to make sure that this works wherever it's used.